What happens after an ASCUS Pap test result? Imagine getting a Pap test result that shows some cells look a little unusual, but you're not sure what it means. That's what an ASCUS result indicates. It stands for atypical squamous cells of undetermined significance. Basically, some cervical cells appear slightly abnormal, but it's unclear whether this is caused by an infection, inflammation, or early changes that could lead to cancer. It's a common finding and usually not a cause for immediate concern. Still, it's important to follow up properly to understand what's going on. For women aged 25 and older, the usual next step is reflex HPV testing. This means testing the same sample for human papillomavirus, which is a key factor in cervical changes. If the HPV test comes back negative, it suggests a very low risk of precancerous changes. In that case, your healthcare provider might recommend returning to routine screening, which typically means a Pap test every 3 years. But if the HPV test is positive, especially for high-risk types like HPV 16 or 18, further evaluation is needed. This often involves a procedure called colposcopy, where a specialist uses a magnifying instrument to examine your cervix closely. During this exam, biopsies might be taken to check for more serious cell changes. For women aged 21 to 24, or if HPV testing isn't available, the usual recommendation is to repeat the Pap test in about 12 months. If the repeat test still shows ASCUS or shows low-grade changes, another follow-up in a year is advised. If abnormalities persist or become more pronounced, your doctor may suggest a colposcopy to get a clearer picture. Colposcopy is a detailed exam that helps identify areas of abnormal cells. It's a safe and effective way to see if there are any precancerous changes that need treatment. The decision to proceed with colposcopy depends on your HPV status, previous screening history, and other risk factors like immune health or past cervical issues. This personalized approach aims to catch any serious problems early while avoiding unnecessary procedures for low-risk cases. If a biopsy during colposcopy finds high-grade changes, such as cervical intraepithelial neoplasia grades 2 or 3, treatment options like removal of abnormal tissue might be recommended. This helps prevent the progression to cervical cancer. If no significant abnormalities are found, your healthcare provider will likely suggest routine screening or periodic surveillance to keep an eye on your cervical health. In summary, after an ASCUS result, the next steps are tailored to your age, HPV status, and overall risk. For women over 25, HPV testing is key. If negative, you can usually return to normal screening intervals. If positive, further evaluation with colposcopy is common. For younger women, or if HPV testing isn't done, repeating the Pap test in a year is typical. This careful follow-up process helps identify women at risk for cervical cancer early, ensuring timely intervention if needed. Always remember, it's essential to follow your healthcare provider's advice and attend all recommended follow-up appointments. Regular screening and prompt follow-up are vital tools in protecting your cervical health and reducing the risk of cervical cancer.